Pauline, and I'll be doing a demonstration of a central access device change addressing on the IV site. This is on the chest. If it was a PICC line, I'd be doing the arm, I'd be measuring the circumference, make sure the length is appropriate, but this is on the chest, so I don't have to do any of that. First, I start by washing my hands, and I enter my room. I introduce myself. I'm Pauline. I'll be changing your dressing to your site. I use two identifiers to identify my patient. I compare it to what I have on my paperwork. I ask the patient his name, Frederick Jones. Okay, Frederick Jones, what is your date of birth? 9/10/24. So those are my two identifiers. Now I'm going to demonstrate doing the dressing change. Okay, I've washed my hands. Now put on some gloves. And just for stimulation's sake, I've already removed, for demonstration's sake, I'll put my gloves on. And I'll be removing the pretend dressing I already have here. So how I would do it, I would take it from the edges to pull it away from the tubing site. So I pull it back, loosen it very gently, or I can get like an alcohol wipe to go around the edges so that I can loosen it up to make it easier to come off the skin. So I'm using an alcohol wipe and I'm rubbing it to get it off. Okay, then I discard that, remove my gloves, wash my hands again. I get my kit. I also would put on a mask. I get my sterile kit. And I have the patient sitting upward, and I also ask them to turn their face sideward as I get ready, as I do the procedure. So I open up my sterile kit. Oh, it has a mask. Okay, sorry. It has a mask. So I use the mask out of the kit. Here I have my mask on. I'll get my sterile gloves out the kit. Oh, they don't have chlorhexidine. They have this. Alright, well, this is not chlorhexidine. This is the COVID. Preparing my stuff to clean my room. The chlorhexidine is open. My alcohol swab, what I use to do that. Okay, my shirt wipe. I prepare to put my gloves on. Okay. I take my chlorhexidine and I will clean around the site. And I'll clean, clean my tubing. Oh, sorry. Clean off the tubing. After I cleaned around the site, dispose of my chlorhexidine. Then I take my shear. It's like a sticky foam. We call it shear prep, or you can call it skin prep. I can take this, just so the skin, I clean the site for 30 seconds. As I'm cleaning the site also, I do my inspection, make sure it's not red or swollen, and there's no oozing coming from the site. And I take my shear prep, and I rub it on the skin. This helps the off-site to stick more firmly. I let that dry. Then, and sometimes we use a padding called a BioPatch, or your BioPatch to put on there just helps reduce infection. And I recoil my tubing. And at this time too, we would place like a piece of tape, or they say a skin. So with this piece of tape, I'm gonna tear it in half to use like a steri strip to anchor my tubing. So I'm gonna recoil it and steri strip it down. Okay. I'll get the Tegaderm. And I'll place that on top of the site. My beer is not that big, so you can picture. I'm pressing firmly just to make sure it sticks very well. And I start peeling my Tegaderm off, and then make sure it adheres to the site. Pressing down as I remove it. As I'm doing this too, the patient's still sitting up and the head is turned the other way. Sometimes when we change them, we also put a mask on the patient. Okay, now that procedure is done, I take all my belongings, pick up my gloves, pick everything up in my kit. And then I take my kit, throw it away, wash my hands again, and I get my pen. And I write down the name, my name, on the piece of side right here, tape. So I write my name, my initials, the date and time I changed the dressing, and I apply this piece of tape onto the side of my dressing. Okay, and that is how you change a central access device dressing. Thank you.